Lung cancer. It is the leading cause of cancer deaths in our state. While smoking is the #1 risk factor, many people diagnosed with lung cancer have never smoked a single cigarette. WFMY News 2's Sydney Moore spoke with a Greensboro man who knows exactly what that's like.
3, 2, 1, 90 seconds hard.
As a fitness coach, 60-year-old Thad McLaurin finds purpose in serving the Greensboro community, choosing to make a difference in the lives around him.
90 seconds hard, pick it up, 90 hard.
And one of his favorite ways to do so is through his running club called the Renegades.
Can't tell you how many people have become best friends from totally different walks of life that have met through the running groups that we've had here.
Looking good, guys, looking good. Keep it going.
Just ask any of his runners. They tell you McLaurin is a great leader who challenges them in positive ways.
He pushes you, and it's kind of like this quiet push. He's like a quiet storm, I guess you could say.
They not only say he's uplifting,
Looking good, guys, looking good. Keep it going.
but inspiring too. On the outside, it's easy to spot the happiness being a coach brings, but on the inside,
A few years ago, I probably wouldn't be here right now.
he's fighting a battle no person wants to fight, stage 4 lung cancer.
When they told me, I kind of felt like I was up here looking down at what was going on, you know, it was very surreal. It makes you numb, it's a gut punch.
I remember one time while he was still running with us on the Greenway, I ran next to him, and I was thinking, okay, Thad has lung cancer. I'm healthy, but he's out here just full of joy.
Prior to his diagnosis in 2023, he says he had a terrible cough that progressively got worse.
I started having, getting out of breath going upstairs, stuff that I would never have ordinarily experienced. So I insisted on an in-person visit.
He then got an x-ray that didn't turn out good and was sent to a pulmonologist.
And she confirmed that it was lung cancer.
The news came to a shock for McLaurin. He has no family history and has never smoked a day in his life.
If you combine the former smoker and the never smoker together, they represent around 60% of our patients.
Dr. Mohamed Mohamed, an oncologist with Cone Health, is part of McLaurin's care team. He says while smoking is the #1 cause of lung cancer, there are several other reasons a person could be diagnosed with lung cancer, including secondhand smoking.
The most common cause for people who never smoked a cigarette to have lung cancer is radon exposure. And radon is a gas. It's a decay gas from uranium in the ground.
After the diagnosis, McLaurin underwent chemotherapy and radiation. Dr. Mohamed then recommended different treatment plans to help manage the cancer.
Luckily, our patient has EGFR mutation, which is one of the most common mutation we see in lung cancer in non-smoker. And he's taken an oral drug, which is a target therapy, and it works better and with less side effects than what we would have done with chemo.
McLaurin has now been living with stage 4 cancer for 2 years. Thankful for the doctors and treatment plans that have given him more time.
I mean, there's always a chance of a miracle, but more than likely it's just something that we'll have to manage. But the goal is just to have a good quality of life.
A good quality of life is exactly how McLaurin chooses to live.
I still do 4 fitness classes with people during the week. I'm not running quite as much, but I can run, so yeah.
And the runners that he coaches are there to remind him of that perspective.
Happy birthday to you.
Just recently, they surprised him at the end of a session, showing their appreciation for all he's done for them. A simple birthday song became more than just a tune. It was a reminder that the people he gives so much to are the same ones who stand with him in the fight. In Greensboro, Sydney Moore, WFMY News 2.
I mean, after hearing that story, we all need to be aware of the signs, the symptoms, and the risk factors that can help catch lung cancer early, even if you have never smoked a cigarette in your life. To talk to us about that with us today is also Dr. Mohamed Mohamed, Thoracic Medical Oncologist with Cone Health Cancer Center and an expert in the lung cancer field. So we just saw that story, and so let's talk about how to prevent lung cancer in people who have never smoked.
Yeah, thank you, Tanya, for inviting me and to also highlight the importance of recognizing lung cancer in non-smoker Definitely, lung cancer is still a disease of a smoker. Almost 85% of the patient that we see with lung cancer are either a smoker or former smoker, but there are around 15% of the patient never smoked a cigarette in their life, and they also can be diagnosed with lung cancer, which unfortunately they come to us in a late stage because non-smokers, they don't sometimes get the same attention as a smoker when they have respiratory symptoms.
Okay, so let's talk about what causes that lung cancer in a non-smoker, and are there groups of non-smokers at higher risk for lung cancer?
Definitely, non-smoker can get lung cancer for many reasons. The most common one is the radon exposure in indoor places. Radon is a decay gas that comes from uranium in the ground, and with our homes, which usually very close, radon can be a very important cause of lung cancer. And it actually by itself is the second most common cause of lung cancer in general after smoking. Also, people with a strong family history of lung cancer and their parents or siblings, these are patients who are also at risk for lung cancer. There are certain occupations that can also increase the risk for lung cancer. Patient who works in roofing, painting, and other industry, aluminum industry. These are patients also that have risk for lung cancer. Secondhand smoking also is a very important factor in causing of lung cancer in non-smokers.
Okay, so what signs should those non-smokers be aware of that could be a symptom of lung cancer? I mean, he said, you know, he kind of got passed on here and there until he finally said, no, I want to be seen in person.
Yeah, definitely. Again, lung cancer, because the non-smoker, and that's what we try to get the attention of many of the primary care provider and other healthcare provider, that if you have a non-smoker who have persistent respiratory symptoms, please don't ignore it. Check it a little bit further. So patient with persistent cough that is not disappearing, patient who coughed blood or sputum that is tinged with blood, patient who have shortness of breath for no cause, weight loss with no explanation. These people should be investigated further to make sure they don't have lung cancer or other type of cancer.
So there might be a few people who said, oh, I have that symptom or I have that symptom. So if they recognize that they're having these kinds of symptoms, who should they be contacting?
Their primary care provider is usually the best resource for them if they have persistent symptoms. Because they are the one who's going to evaluate and make sure that they get the right test done initially. And if there is any concern, they usually send them to our multidisciplinary clinic to take over.
Okay, and you just mentioned a test. Is there a specific test that a non-smoker should have?
There is no screening test for non-smoker at this point because, again, the percentage of people when the non-smoker who get lung cancer is still lower than the smoker population. But definitely persistent cough that did not disappear after flu symptoms or shortness of breath that persisted could indicate some imaging studies, including chest X-ray or CT scan.
What about someone who quit smoking years ago? How concerned should they be?
They definitely should be concerned. You never come to the baseline like somebody who never smoked. It may take more than 20 years of quitting smoking to come close to the baseline for somebody who never smoked. So these people are still at very high risk to develop lung cancer.
All right, let's talk about then the screening for lung cancer. If you are a former smoker or you're a current smoker, and that screening that you need to talk to your provider about.
The good thing we have now screening tests for lung cancer that were not available several years ago, and the guideline actually become more flexible with us. So anyone who smoked more than 20 back year history, 20 or more 20 back year history of smoking, one bag for 20 years, two bags for 10 years, you can make the calculation. Somebody who quit smoking, it doesn't matter now the duration, we used to limit it to 15 years. But if you quit smoking 25 years ago, you're still eligible to be screened. And anyone who had that criteria over the age of 50 to 80 are included in these screening criteria.
Yeah, and if you noticed yourself in any of those screening criteria, you don't want to wait till you have symptoms to get that
No.
screening. Let's talk about the importance of early detection.
Yes, and that's exactly what you're talking about, Tanya, because the early detection of lung cancer through the screening program, we catch people in early stage lung cancer that can be surgically resected or treated local rather than having them in stage 4 when the treatment is only palliative. So that's very important to screen anyone with the criteria I mentioned, age 50 to 80, smoking 20 back year history, regardless when you quit smoking, even if you quit 25, 30 years ago, you're still eligible to get screened. These people should screened annually to catch them early and had surgery.
All right, and some folks may be just joining us right now. Maybe they didn't see the story that we told about a local man who had never smoked before and who has lung cancer. For people thinking, I don't need to worry about lung cancer because I didn't smoke, you would say what?
No, if you have lung cancer, if you have lungs, you are at risk for lung cancer. All of us at risk for lung cancer. I just mentioned to you, I have very young population of people that are diagnosed with lung cancer. Unfortunately, it does not discriminate against age or race or smoking history. If you have lung, you can get lung cancer.
All right, and final thoughts on this, and maybe you touch back on the whole radon gas and how people need to test in their homes.
Yes, absolutely. You should test your home regularly for radon gas exposure because that's the second most common cause of lung cancer in general and the most leading cause of death among non-smokers who get diagnosed with lung cancer. And again, as we mentioned, if you have lung, you're still at risk for lung cancer regardless of smoking history or age.
All right, Dr. Mohamed, thank you so much for your time and your expertise. If you missed any of this, you want to pass it along to a family member or a loved one. It's going to be in the To Your Wellbeing section of our website.